Hi, Hina.
Hi, Angie.
We're talking about Wegovy today.
Yeah.
Can you tell me, what is it? Is it similar to Ozempic?
Sure. So Wegovy and Ozempic actually contain the same active ingredient, the drug semaglutide.
Okay.
However, its key differences are what they've been licensed for and what they're indicated for. Wegovy is licensed for weight loss management, whereas Ozempic has been licensed for type 2 diabetes management.
Right.
The other key difference is the doses in which they come. So Wegovy, we can give up to doses of 2.4 milligrams weekly, whereas Ozempic only goes up to 1 milligram weekly.
I see. So who should actually be using it?
So at the moment, Wegovy we like to use for patients who are struggling with their weight. It's used for weight loss management. So we would give it to a patient with a BMI of 27 and above, or for patients who have got weight-associated conditions. It also has proven cardiovascular benefit, and there's evidence to show it can reduce cardiovascular outcomes such as heart attack, stroke, and death from cardiovascular disease. So your doctor may think that it's a good option for patients with high blood pressure, high cholesterol, where weight is also an issue.
That's really interesting that it's got those added benefits as well. Great to hear. So I'm assuming this is safe. What are the side effects that people might expect?
So yes, it is a safe drug. Wegovy itself is a relatively new drug. However, the class of drug that it belongs to, which is the GLP-1 receptor agonists, have been on the market for a long time, over 20 years, mainly for their use in type 2 diabetes. Therefore, we do have a lot of long-term studies to show the safety of this drug. It does have side effects, mainly to do with the tummy. It can cause diarrhea, constipation, nausea, vomiting. And some people will also report fatigue and low energy.
Okay, so what is the treatment journey? Someone would come to you for a consultation, then what happens?
So someone would come for a consultation. They would be ready to talk about their weight or address their weight. We would take some baseline measurements, their height, their weight, calculate their BMI. We would do some baseline blood tests as well. And we would take a thorough history from them. So have they tried to lose weight before? Do they have any other medical conditions? What medication are they taking? Once we decide that Wegovy is appropriate for them, we would start them on the lowest dose of 0.25 milligrams weekly. We would show them how to use the injection weekly, and we would counsel them about the side effects. We then ask them to come back once a month, and we escalate the dose every month. If the side effects are too much, we would ask them to stay on a dose before we increase them further. So we always work with the patient to make sure it's the right thing for them and that their journey is fruitful and it's made easy for them.
I love that. So it's very much measured and monitored.
Definitely.
I love that. That's great. Thank you so much.
Thank you, Angie.